Vesper, a 72-year-old retired music teacher, spent decades filling rooms with melodies and laughter. But lately something feels off. She forgets simple things, misplaces her sheet music, and feels drained even after a full night's sleep. Her hands tremble slightly as she pours tea, brushing it off as nerves, until one afternoon she nearly collapses. The room spins, her heart pounds, and she grips the counter for support. Her doctor dismisses it as just aging, but deep down, Vesper knows something isn't right. What's truly happening? Most senior women don't realize that hidden infections can mimic aging, silently attacking the brain, heart, and immune system. Her doctor dismisses it as just aging, but deep down, Vesper knows something isn't right. What's truly happening? Most senior women don't realize that hidden infections can mimic aging, silently attacking the brain, heart, and immune system. Could an undetected illness be the real cause of Vesper's decline? If you've ever felt off but couldn't explain why, keep watching, because the answers might save your life. Have you or a loved one ever had unexplained symptoms dismissed? Share your experience in the comments below. Vesper's story isn't unique, far from it. Across the world, countless senior women experience unexplained fatigue, memory lapses and weakness, only to be told it's just a part of aging. But what if it's not? What if something more dangerous is silently at work? Hidden infections are among the most overlooked health threats for senior women. They don't always come with fever or pain. Instead, they quietly affect the brain, heart, and immune system, making you feel unlike yourself. A simple urinary tract infection can mimic dementia. A low-grade respiratory infection can leave you exhausted for months. A hidden gum infection can increase the risk of a heart attack. These aren't rare cases, they happen every single day. The worst part? Many women never realize what's happening until it's too late. Like Vesper, they accept the slow decline, unaware that something treatable is draining their energy and clarity. But you don't have to be one of them. If you're here, it means you care about your health, or the health of someone you love. And that's why this information is so important. Right now you have the power to protect yourself by simply staying informed. But here's the reality. Most people watch videos like this and move on, forgetting the life-changing advice they just heard. Don't let that be you. The silent threat UTIs that mimic dementia. Vesper had always been independent and sharp-minded, but lately something felt wrong. She kept forgetting why she walked into rooms, struggled to find the right words, and felt exhausted even after a full night's sleep. Some days she was unusually moody, snapping at little things. Other days she just wanted to stay in bed. Her doctor dismissed it as normal aging, but the truth was far more dangerous. Vesper's sudden confusion wasn't forgetfulness, it was a UTI affecting her brain. Most people think UTIs come with obvious symptoms: burning pain, frequent urination, but in senior women they can look completely different. Instead of pain, UTIs can trigger symptoms that mimic dementia: brain fog, struggling to focus, forgetting conversations, fatigue, feeling drained no matter how much rest you get, mood swings, sudden irritability, depression or anxiety, unexplained dizziness or falls, a serious risk for seniors. Since these symptoms don't seem like an infection, many women go undiagnosed for weeks or even months until the infection worsens. Most women don't even realize they have a UTI because 1 in 3 women over 65 will have a UTI this year without knowing it. Unlike in younger women, where the symptoms are obvious, senior women often have silent UTIs that don't cause pain, but attack the brain and body instead. If left untreated, these infections can spread to the kidneys and even the bloodstream, leading to life-threatening complications like sepsis. In severe cases, hospitalization is needed. Why does this happen? Weakened immune response makes infections harder to fight. Lower estrogen levels thin the bladder lining, making it easier for bacteria to thrive. Mild dehydration, common in seniors, allows bacteria to multiply faster. Bladder changes with age make it harder to fully empty, increasing infection risk. Doctors often mistake these symptoms for early dementia, delaying proper treatment. Vesper's case is not unique. Many women suffer from UTIs without ever realizing it. How many others are misdiagnosed simply because no one connects these symptoms to an infection? Have you or a loved one ever had a UTI with unusual symptoms? Share your experience in the comments. Your story could help someone recognize the warning signs before it's too late. Respiratory infections that drain your strength. Vesper never thought much of her occasional cough. It wasn't severe, just a mild tickle in her throat that came and went. She had no fever, no chills and no sharp chest pain, just a lingering cough and a growing sense of exhaustion. At first she brushed it off. Maybe it was allergies, maybe it was the colder weather, but as the weeks passed her fatigue deepened. She felt drained even after a full night's sleep. Climbing a flight of stairs left her breathless. Even simple tasks like making tea or folding laundry made her sit down to rest. What she didn't realize was that her lingering cough wasn't harmless. It was walking pneumonia. A hidden threat in seniors. Unlike severe pneumonia, which comes with a high fever, chills and sharp chest pain, walking pneumonia develops slowly and often goes unnoticed. It's a low-grade respiratory infection caused by bacteria that lingers for weeks or even months, gradually weakening the body. Many seniors mistake it for a mild cold, allergies, or simply aging, but ignoring it can lead to serious complications. Why are seniors at risk? Well, a weakened immune response makes it harder for them to fight off infections. Also, reduced lung capacity with age means infections take longer to clear. Mild symptoms often make it easy to dismiss as just a cough. Delayed treatment increases the risk of complications like severe pneumonia or hospitalization. Because these symptoms don't seem alarming, many seniors delay seeking medical help until they're struggling to breathe. By then, the infection may have spread deeper into the lungs, leading to complications like severe pneumonia, bronchitis, or even respiratory failure. One simple test can diagnose it, and early treatment can prevent serious illness. But the key is recognizing the symptoms before it's too late. Have you or a loved one ever had a lingering cough that turned out to be something serious? Share your experience in the comments. It could help someone recognize the warning signs early. Hidden oral infections that wreak havoc on the heart. Vesper had always taken care of her teeth. She brushed twice a day, flossed when she remembered, and never had a cavity in her life. So when her dentist mentioned signs of gum inflammation during a routine checkup, she was surprised. She had no pain, no swelling, nothing that seemed like a problem. But a closer look revealed something more serious, a hidden gum infection that had been quietly spreading for months. What Vesper didn't realize was that oral infections don't just stay in the mouth. They can travel through the bloodstream and damage the heart. Many seniors believe that if their teeth don't hurt, their oral health must be fine. But gum disease and hidden infections can develop painlessly, making them easy to miss. Meanwhile, bacteria from these infections enter the bloodstream, triggering inflammation throughout the body, especially in the arteries. Studies show that people with untreated gum disease have a 2 to 3 times higher risk of heart attack, stroke, and other cardiovascular issues. How oral infections attack the heart. Bacteria enter the bloodstream through infected gums, spreading inflammation. Arteries become inflamed, increasing plaque buildup and blood clot risks. Heart valves are especially vulnerable. bacteria can stick to them, causing a life-threatening condition called endocarditis. Weakened immune function in seniors makes it harder to fight these infections. The scariest part? Most seniors don't know they have an infection until it's too late. Since these symptoms aren't always obvious, many seniors only discover a serious problem after a major health event, like a heart attack. After her dentist diagnosed the infection, Vesper was shocked to learn that it could be affecting her heart. She had no idea that something so silent could be so dangerous. With proper treatment, she was able to stop the infection before it spread further. But how many others are still unaware? Practical takeaways. How to detect and prevent these hidden infections. Hidden infections can quietly drain your health, leaving you exhausted, foggy-headed, or at serious risk for complications. Many seniors mistake these signs for normal aging, but they're not. The good news? These infections are preventable if you know what to look for. Scene 2. UTIs, signs to watch for. Here's how to detect and prevent 3 of the most overlooked infections in senior women. Number 1. UTIs, more than just a bladder infection. A urinary tract infection, or UTI, doesn't always cause burning pain or urgency in older adults. Instead, it can look like dementia, depression, or extreme fatigue. Scene 3. UTI symptoms. Signs to watch for: confusion or brain fog, forgetting conversations, struggling to focus. Sudden fatigue, feeling drained for no clear reason. Mood swings or irritability, unexplained anxiety or depression. Frequent urination or sudden incontinence, even if it's mild. Dizziness or unsteady walking, a common but overlooked symptom. How to prevent it? Stay hydrated. Aim for at least 6 to 8 glasses of water daily to flush bacteria. Take probiotics. They help maintain a healthy balance of bacteria in the bladder. Urinate regularly. Holding in urine allows bacteria to multiply. Practice good hygiene. Wipe front to back and use gentle, unscented soap. Get tested if symptoms appear. A simple urine test can confirm an infection. Many urinary tract infections go unnoticed until they cause serious complications, but early detection can prevent hospital visits and long-term damage. A lingering cough or mild shortness of breath might not seem like a big deal, but in seniors, it can be a sign of walking pneumonia or a low-grade respiratory infection. These infections can weaken the immune system over time, leaving you constantly exhausted. Signs to watch for: a persistent cough, even if it's mild or dry. Shortness of breath, especially after light activity. Ongoing fatigue, feeling weak for weeks or months. Mild chest discomfort, not as severe as typical pneumonia, but still present. Dizziness or feeling faint. Low oxygen levels can cause this. How to prevent it? Don't ignore a lingering cough. If it lasts more than 2 to 3 weeks, see a doctor. Get a chest x-ray. Many cases of walking pneumonia go undiagnosed without imaging. Use a humidifier. Moist air helps keep your lungs clear. Stay active. Gentle exercise like walking strengthens lung function. Wash hands frequently. Respiratory infections spread easily through touch. Walking pneumonia can last for months if untreated, but early detection can prevent long-term fatigue and complications. Scene 10. Oral infections. Signs to watch for. 3. Oral infections. The hidden danger to your heart. Many people think that if they don't have tooth pain, their mouth is healthy. But gum disease and oral infections can silently spread bacteria into the bloodstream, increasing the risk of heart disease, strokes, and other serious conditions. Scene 11. Oral infection symptoms. Signs to watch for: bleeding gums, even minor bleeding while brushing. Persistent bad breath caused by bacteria buildup. Receding gums, teeth appear longer than before. Loose teeth or a shifting bite, a red flag for deep infections. Swollen or tender gums, even without pain. How to prevent it? Get regular dental checkups. Even if you have no pain, see a dentist at least twice a year. Use an antibacterial mouthwash. This helps kill bacteria in hard-to-reach places. Floss daily. Plaque buildup between teeth can lead to infections. Limit sugary and acidic foods. These feed harmful bacteria in the mouth. Watch for gum inflammation, redness, swelling, or tenderness can be early signs of an infection. Since oral infections don't always cause pain, many people don't realize they have one until it spreads. Taking care of your mouth protects more than just your teeth. It protects your heart. These infections are silent but serious, and many seniors suffer simply because they don't know the signs. But now you do. If you notice unexplained fatigue, brain fog, or unusual changes in your health, don't ignore them. Small symptoms can be signs of bigger problems, but early action can prevent life-threatening complications. Have you or a loved one ever caught an infection early because you knew the signs? Share your experience in the comments. Your story could help someone protect their health before it's too late. Vesper had spent months feeling unlike herself. Her sharp mind dulled, her body weak, and her energy drained. She had convinced herself that it was just part of aging, as everyone around her said. But after learning that hidden infections were the real cause, everything changed. Once she received proper treatment, her transformation was undeniable. Her energy returned, her mind cleared, and the dizziness disappeared. She no longer felt like she was fading away. She felt alive again. Vesper's story is more than just a personal victory. It's a warning. Too many seniors dismiss serious symptoms as aging, just as she did. But aging isn't the cause. Undiagnosed infections often are. Had she ignored her symptoms, the outcome could have been far worse. But because she searched for answers, she got her life back. Vesper's experience proves that understanding these hidden infections isn't just helpful, it's life-saving. No one should suffer from unnecessary fatigue, brain fog, or heart risks simply because they don't know what to look for. By recognizing the signs early, you or a loved one can prevent a serious health decline. Have you ever mistaken a health issue for aging? Share your experience in the comments. Your story might help someone else take action before it's too late. Now that you know the signs, you have the power to protect yourself and your loved ones. No one should suffer simply because they didn't have the right information. If this video helped you, subscribe for more essential health insights and share it with another senior woman. You never know whose life you might change, because when it comes to health, knowledge isn't just power, it's survival. If this video helped you, subscribe for more essential health insights and share it with another senior woman. You never know whose life you might change, because when it comes to health, knowledge isn't just power, it's survival. If this video helped you, subscribe for more essential health insights and share it with another senior woman. You never know whose life you might change, because when it comes to health, knowledge isn't just power, it's survival.